Hey, good morning, everybody. Welcome to another awesome episode of Digital Health Today with a distinctly Australian flavor. I'm Dr. Bernie O'Brien at Discover Chiropractic in Burnsville. Hi. So just waiting for a few people to join Instagram here. We've had so many amazing followers join our Instagram page, our YouTube, and our Facebook. So keep joining and keep spreading the amazing word. We're really excited for that. Today, the topic is going to be chiropractic and headaches and migraines. How are they related? What causes them? And most importantly, what can you do? What are you not doing that you can do that's totally different, that can eradicate headaches and turn your life and your health up? So let's get into it. So the two classic types of headaches are one, tension headaches, and two, migraine. So let's define tension headache. What is it? Well, it's tension. Tension headache. It's pain of the head through tension, stress, tightness, contracture. Okay, so what do you feel? Well, typically most tension headaches will start right here in the base of the skull, and they can migrate to the front. They can start across here as a band of pressure and tension and tightness and soreness. So the tension headache is tightness of the muscles and the ligaments in the suboccipital, sub less than occiput, back part of your neck, or the temporal region of the muscles and the tissue and the fascia right across there. So it causes achy, tight pain, and it's just no fun. It sucks. It really just boils down to it stinks. And the studies show most people get tension headaches, and the vast majority of people get headaches 1 to 3 times a week. So how do you get these tension headaches? And then what can you do about that? Well, tension headaches come from the neck. You get a subluxation. It's a misaligned vertebrae. I've got a couple of awesome slides to show you in a second, but you get these tension headaches from a subluxation. Well, let's define subluxation, how you get it, what does it do? So a subluxation is a misalignment of the vertebra of the spine. In the neck, right here, we have 7 vertebrae, cervical vertebrae, and they misalign through trauma, microtrauma. You can learn to walk, you can fall, car accidents, bad posture, slip on the ice. There's falls, accidents, trauma, and microtrauma. It's not that that's important, because we've all had so many of those. So we just want you to know that's what happens. Let's disregard that now. But when you get the subluxation, it's a disease process. And what it does is it puts pressure on the spinal cord and spinal nerves over time, creating damage to the cells, tissues, well, in this case, muscles, ligaments, tendons, fascia, around the base of the skull, suboccipital and temporal, and that causes tightness. So imagine this. I grab the skin on your arm and I pinch really hard. Does that hurt? Sure. What's the problem? Pinch or the pain? Well, I've asked that question to tens of thousands of patients over near 30 years of practice here in Burnsville. And almost exclusively, okay, it's a 50-50. Pain's a problem, pinch is a problem. Here's the answer, folks. It's the pinch. You got to know that, right? So if I pinch you, it hurts. If I don't pinch you, there ain't no pain, right? So pain is not the problem. It's the effect. Cause, pinch, pain, effect, you see. So we got to start to understand that our headache pain is the effect of tight muscles and ligaments from a subluxation in the neck. Let me show you a couple of x-rays here. Forgive me while I figure out how to turn this phone around here. So right here, we have x-ray 1. And this is a beautiful young woman that came into my office here about a year ago. And you'll see this bone right here. That bone there is called the atlas, first neck bone. And you'll see here it's at 16 degrees. Well, that's meant to tilt more down this way, like 31. You'll see this neck curve. It tilts forward here and straight here. We call that a reverse curve. The neck should curve in a curve backwards like that. And the last thing is we have this gravity line here. And this falls 3.8 4 centimeters forward. And that is way out of alignment. And that's what a subluxation looks like. And that puts pressure on the spinal cord, spinal nerves, affecting the cells, tissues, and organs of that area that those nerves supply. So after corrective chiropractic care, adjustments, stretches, exercises, we enabled through our specific postural weighting system and our in-office specific technologies that we exclusively use in Burnsville to enable massive change. If we can see this here, now we can see the atlas is tilted 34. Now we see our gravity line is normal. Now we see our curve back. Now if we can pan out and you can get a view of those two next together, you'll see a massive difference. So this young lady went from tension headaches 3 to 4 times a week for a couple of years down to 0 tension headaches. What an amazing difference. How many of you out there watching, your friends, your family, your loved ones, your neighbor, your sister, your brother, your mother, your father, your children have these tension headaches and they're taking Advil? There's a better way, folks. Sign up, open your eyes up, and tune into the end, and I'll give you a great scenario and great opportunities to get in or read or learn about this. Story number 2, chiropractic and migraine headaches. So what is a migraine headache? Well, it is different than a tension headache in the fact that it's a vascular headache. The arteries to the brain vasospasm, and that causes 2 things: pain, but also a change in blood flow to the brain. Very, very nasty. Ugh, they suck. For those of you that have migraine headaches, tune in right now, or tension headaches for that matter. So how a migraine headache occurs, there's multiple factors, but from a chiropractic viewpoint, please understand this, okay? I'm going to be speaking to that only, so tune into that. So a chiropractor deals, again, as I talked about, the central nervous system. Well, I got to take you over here and show you a couple of tidbits up here so you can see how this works, okay? So just bear with me, come over here. I'll flip this camera around, and we're going to come up to here. Once again, we've got the neck here. I'll try to get this pattern off. Right here, atlas axis. Those top 2 bones through the brainstem spinal cord, right here you got these ganglion systems that affects what's called the autonomic nervous system. And right there you can see this artery here. Those arteries go up into the brain. So when you have a mechanical distortion, subluxation of C1, C2, atlas axis, upper neck right here, that can affect those nerve systems. Well, that can change the arterial control. So if it gets irritated, it might cause that constriction. Now that's preceded by sometimes tunnel vision, okay? Wavy lines in the visual field, okay? And then it's by this massive, debilitating, pounding, throbbing, life-altering, horrible headache. And unfortunately, a lot of people can get these weekly or 2 or 3 times a month, and they're not fun, and you know that they're terrible. So I want to show you an x-ray of a beautiful patient of ours that came in with migraine headaches. And once again, I will show you the left one. Let me pull it up here in a second. Please forgive me. Now right here, we've got this again, same anatomy, atlas 22. It's meant to be 31. It's a straight curve through here. It's meant to be a little more arched like this, and then we've got forward head posture. So right up here, okay, the arteries run up into the brain here, the ganglion, that's just a cluster of nerve fibers, and over here you'll see the correction. We've gotten 33, we've restored that curve, and that forward head posture has come back. And that's taken the pressure off of this, releasing that wellness, that wisdom from the brain through the spinal cord, spinal nerves over time to enable the body to heal. So right there, you can see the difference from the left x-ray, the initial, and to the post x-ray. And so this person, let me tell you the story. I met this person 20 years ago, and they had headaches, migraines 1 to 2 times a week, and they would have to take an injection, and it was heroin. Well, actually it wasn't heroin, but the class of drug was the same as heroin, and it's a heavy narcotic. It's a potent pain reliever, and thank God that we have that for this person. However, if we look beyond the symptom, the pinch, the pain, and we looked at the cause, and we looked at this person's spine as I showed you, and we corrected it as I've demonstrated. 80% of people with headaches and migraines have a reduced or disappear. So this young, beautiful person went from headaches every day to having maybe one headache, migraine a year now. Think about that. 1 to 2 days completely destroyed, down, in bed, suffering. Now, maybe one a year. That is amazing. So for you people out there that have headaches, that have neck pain, that have migraines, you've got to tune into this and do yourselves a favor. Message us, follow us on YouTube, follow us on LinkedIn, follow us on Facebook. You can follow the notes you can click the links in the notes. But download my ebook. Get it, read it, understand it. There's a better way to live. If you're taking headache medication, Advil, ibuprofen, and you're taking it 2 or 3 times a week, you ask yourself, what's that going to do to my kidneys, my liver, my health? What's the toxic side effects? You gotta face facts. Drugs are poison. Great first aid, but poison. Look to the cause. Come on in, and also this week we're doing an amazing offer. Personal messages. We're doing a $25 exclusively today and this week for new patients, exclusively to come in for a day 1 consult, exam, and x-ray. Costs $300+, but you'll get it for $25. And for the next 10 people that sign up and email us or text us or follow through, you'll get the first adjustment on day 2 included in that. So give us a call, be proactive. Thanks so much for listening. Click the like, share, post it. Have an amazing day, and we'll catch you on our next episode. Bye now.